All right, if you're a nursing student getting ready for your OB rotation or, the big one, the NCLEX, you've come to the right place. We're going to do a deep dive into prenatal care, breaking down everything from that very first assessment all the way to those critical clinical judgments you'll need to make.
So, here's our game plan for today. We're going to kick things off with the absolute foundations, then walk through assessments and the key lab tests you have to know. After that, we'll cover patient education for each trimester, tackle those common discomforts, and then wrap it all up by really sharpening your clinical judgment. Let's get into it.
First things first, let's start with the basics. Before we get into all the things you need to do, we really have to understand why we're doing them. So, what is prenatal care really, and why is it so unbelievably important? Here's the key takeaway. Prenatal care is so much more than just a series of doctor's appointments. It's really a partnership. As nurses, our job is to assess, to teach, and to support our clients, really empowering them to take charge of their own health for the best, safest possible outcome.
Now this right here, this is critical. Think about that time frame. 2 to 8 weeks is often before a person even definitively knows they're pregnant. This fact alone just hammers home why getting into care early and staying consistent is not just important, it's vital. We're talking about the most critical window of development.
Okay, so let's move into the assessment. This is where we as nurses become detectives. We're gathering all the little puzzle pieces to build a complete, holistic picture of our client's health.
And that initial history is, well, it's incredibly thorough for a reason. We're digging deep. We're not just asking about this pregnancy. We need to know their entire health story. Past pregnancies, any medical issues, family history, their support system, even what they hope for in their birth plan. Every single piece helps us spot potential risks and customize their care.
And this timeline really shows you how our vigilance ramps up as the due date gets closer. We start out monthly, which is pretty standard, but then we shift to every 2 weeks, and finally, we're seeing them weekly in that last month. Why? Because it lets us keep a much closer eye on both mom and baby, ready to catch any changes right away.
So each of those follow-up visits has this very consistent rhythm to it. We're checking weight and blood pressure, looking for signs of hypertension, we're dipping urine to screen for things like infection, diabetes, or preeclampsia, and of course we're listening to that beautiful fetal heart rate, measuring fundal height to track growth, and checking in on fetal movement. It's a routine, sure, but it's a powerful one.
All right, let's peek behind the curtain at the science. These lab tests are absolutely essential. They give us that detailed, objective data about what's going on inside, things we just can't see from the outside.
Honestly, think of this table as your ultimate NCLEX cheat sheet. There's a really clear pattern here, right? It's all about if this, then that. If the client is Rh negative, we know they'll need RhoGAM. If that 1-hour glucose test comes back high, we know the next step is a 3-hour test. And if they're GBS positive, we're planning for IV antibiotics during labor. It's all about proactive care.
Being a great nurse isn't just about the tasks you perform. It's about what you can teach your patient. And truly effective teaching means giving the right information at just the right time. So let's break that down by trimester. In that first trimester, it is all about laying a healthy foundation. We're helping our client understand the huge changes their body is going through and how to manage those early discomforts like nausea. This is also where we talk about nutrition, exercise, and avoiding harmful substances. But maybe most importantly, this is when we first introduce those critical warning signs they need to watch out for. Then we hit the second trimester, and the education really starts to shift. It becomes more about active participation and planning for the future. We teach them how to monitor their baby's movement, which is such a key sign of well-being. We talk about safety things like how to wear a seatbelt correctly, and we start those bigger conversations about their birth plan. It's all very forward-looking.
And finally, the third trimester, it's go time. All of our teaching becomes laser-focused on getting ready for labor, delivery, and life with a newborn. We're talking childbirth classes, pain management options, and that classic question, how to tell if it's true labor or false labor. We're just trying to empower them for that final stretch.
Okay, let's do a quick-fire round on some of those super common discomforts. I guarantee these are the things your clients will be calling you about, and having simple, effective advice ready to go is a core nursing skill.
Heartburn.
Oh, it's such a common one. The advice here is really practical and simple. It's all about managing meal size and timing. Small, frequent meals, and just trying not to lie down right after eating can make a world of difference.
Backaches are almost a given, right? With all the physical changes happening. So to manage them, we focus on being proactive.
We teach things like pelvic tilt exercises to help support their changing body, using good body mechanics and finding comfy positions for rest.
And this is a huge safety point. It's absolutely critical. When a pregnant client lies flat on their back, the weight of the uterus can actually press on the vena cava, which reduces blood flow back to the heart and to the baby. So we always teach them to lie on their side or propped up a bit. It's such a simple piece of advice that prevents a really dangerous situation.
All right, we've arrived at the most important part. This is where the rubber meets the road. It's about shifting from just knowing stuff to actually applying it. Recognizing these danger signs and knowing exactly what to do next, that's what makes you a safe nurse.
Early on in the pregnancy, the red flags are very clear. Burning with urination, we're thinking infection. Severe vomiting that just won't stop could be hyperemesis gravidarum, and any cramping with vaginal bleeding has to be checked out immediately to rule out a miscarriage or an ectopic pregnancy. No exceptions.
As the pregnancy goes on, the list of danger signs gets a bit longer. A sudden gush of fluid, any vaginal bleeding, a noticeable change in fetal activity all warrant an immediate call. But I want you to pay special attention to this cluster of symptoms: severe headaches, vision changes, swelling in the face and hands, and that upper abdominal pain. Those are the classic textbook signs of gestational hypertension or preeclampsia, which is a true medical emergency.
Okay, time to put it all to the test. Here's a classic NCLEX-style question. Take a look at these 4 options. Your job as the nurse is to separate the normal, expected discomforts from the one true danger sign. What's the priority? Which one has to be reported?
The answer is A, vaginal bleeding. Absolutely. Ankle swelling, heartburn, feeling a little lightheaded when on your back, those are all common discomforts that we have ways to manage. But vaginal bleeding at any point during pregnancy is never considered normal. It's a potential danger sign that has to be evaluated right away. That's the kind of critical thinking you need.
Okay, let's put it all together. Here's your final scenario. Imagine you're the nurse who picks up the phone. A client who you know is 32 weeks pregnant calls and tells you she's had a severe headache for 12 hours and Tylenol isn't touching it.
So, based on everything we've just talked about, all the assessments, the labs, and especially those danger signs, what is your priority? What is the single most important action you need to take for this client right now? This is what nursing is all about. This is clinical judgment. What's your next move?